Hello everyone, here we'll try to understand what is resting membrane potential. Before that, we'll try to understand what is Gibbs-Donan effect. Gibbs-Donan effect is when a non-diffusible anion is added to a KCl solution which is equilibrated across the membrane, and introduction of this will lead to the movement of potassium to the A compartment and movement of the chloride to the compartment B. That causes unequal distribution of the ions across the cell membrane. The same thing is going to happen in the animal cell, where because of the Gibbs-Donan effect there will be unequal distribution of the ions occurs, where potassium is highly concentrated inside compared to the extracellular fluid, and sodium is low and the chloride is also low compared to the outside. So this is the chloride. So during the resting phase, this unequal distribution of the ion leads to the movement of the ions, where potassium tries to move towards outside and sodium and chloride inside. But the movement of sodium and chloride will not compensate for the movement of the potassium, because the cell membrane is highly permeable for the potassium. That leads to increase in the negativity inside the cell compared to the outside. At the same time, we have sodium potassium pump, which pumps 2 potassium inside and 3 sodium outside, will help in some of the compensation of the potassium, and it also makes the inside of the cell more negative. And the permeability nature for the potassium and sodium potassium pump, they are responsible for the increase in the negativity inside the cell up to millivolts, and so this status is called as resting membrane potential.